So we've done learning from stage 1, and feedback from our experts was concerned about an overview of how the 50 applications did. We've learned from experience, from know what works and what didn't work, and what he's learned. Now I want to go a little bit deeper into just one of the issues. There's lots of issues around this, as I'm sure you're aware. Then a little bit more about one of the issues. And I'd like to invite Dr. Alain Gregoire, founder and chair of the Maternal Mental Health Alliance, and a consultant perinatal psychiatrist, to come and join us.
Thank you very much. It's a real pleasure and an honour to speak to you all, you hard workers out there who are going to change the lives of so many people. Some of you may have seen the Panorama programme last night, a rather shocking Panorama programme about the out-of-hours work of a police station in Southampton, which is the area where I'm fairly regularly a duty psychiatrist. And what that Panorama programme showed, for those of you who didn't see it, was the 30% of the work of the police out of hours coping with people with mental health difficulties, throwing themselves off bridges, fighting the police, people with drug and alcohol problems, people with severe depression, mixed in with violent, at one point in the programme, criminals and other rather desperate people in the police cells. And I mention this because you may think that's very far removed from the early years, pregnancy and the first couple of years of life. But it's actually the result of our society's neglect of pregnancy in the first 2 years of life. The majority, if not all, the people I see out of hours in police cells with mental health problems, those utterly desperate people who we put in the most appalling circumstances. If they were animals, the RSPCA would be down on us all in society for treating living beings in that way. Almost all of the people I see in that situation have been neglected or traumatized or abused as children. And many of you will have heard of the term personality disorder. Personality disorder and the sort of heart-sink reaction we people in health, in mental health, in A&E departments, in primary care, in social services, in housing departments, have as a reaction to people with these difficulties, should bear in mind that the majority of them, 80 to 90% of them, have been neglected or traumatized or abused in childhood. And there is an absolute direct link between the difficulties they have throughout their adult lives and their childhood. Now, that sounds pretty desperate, but actually, what a fantastic opportunity that knowledge gives us to transform human existence and society, not just for the next generation. That's not what you're doing. Nothing as unambitious as that. You are going to change lives for the generation after as well, and the generation after that, and the generation after that. Because healthy, happy, well-functioning brains and minds are what allow us to be the good parents that produce the healthy, happy, well-functioning children that produce the healthy, happy, well-functioning adults. The reason you are all in this room is actually nothing to do with the big lottery. It's because you have pretty well-functioning brains. It's not your livers. It's not your legs. Yes, your legs may have got you the final leg of the journey, but it's your brains that got you here. And how come we have a well-funded physical health service for women in pregnancy and postnatally? One to be truly proud of, that makes a big difference to the physical health of women in pregnancy and postnatally, and to the outcomes for their children. But we totally neglect their brains and their minds' needs at this time, and the impact that that has on children. What an outrage in a well-developed, extremely wealthy, you may not believe it, extremely wealthy nation. One of the most wealthy nations in the world, aren't we? And yet we neglect the most important part of human function. So that's what I'm going to be talking about, because my business, my work in life, is trying to help people with, I suppose, the most severe problems with their brains and their minds. And I started my career in medicine and obstetrics, but rapidly realized that the women with the most severe difficulties and the greatest need who receive the worst care from the health service, and not just the health service, the whole of society, housing departments, social services, were people with mental health problems, and so I transferred into psychiatry. So I'm partly speaking with that hat on, but I'm also speaking with a hat on as a representative and chair of an alliance of over 40 national organisations who have got together with a determination to change this situation and to make these lives and future generations happier and healthier. So I'll give you a little bit of data. And to start with, here's a graph, here's a pretty coloured graph that illustrates the challenge that we face in terms of mental health problems. This is the prevalence of various disorders in pregnancy and postnatally. And there you can see at the very top of the list in terms of frequency, depression. Depression is a very severe disorder which is extremely disabling. It stops us doing the things we need our brains to do for us. And you can see listed next to it the sorts of things that maternity services provide: a midwife for every woman and a hospital in every part of the country accessible to every woman in pregnancy and postnatally. And there has been a big impact on those physical health problems through that provision. But the specialist dedicated provision for mental health needs is extremely poor and maybe non-existent. Now that is a prevalence figure. A prevalence figure is how many women are afflicted by this problem at any given point. So that's frequently quoted as 10 to 15%. But if you look at the whole period of pregnancy and the postnatal year, and maybe the few years after that, when children are growing up, you find that in the first 16 years, 2/3 of women suffer from depression at some point. That's a kind of shocking figure. This is in a deprived South London population, probably slightly lower figure in slightly different populations. Half of those women, that depression developed in pregnancy. So this is a period prevalence. So that is the true figure of the number of women affected in deprived populations. And don't fall into thinking, well, it's just feeling a bit low. That's not a serious health problem. Depression is the most disabling health problem known to humankind. And in women in reproductive years, it tops all of the other disorders known to man in terms of life years lost through early death or disability. Not a lot of people know that. And the dark blue still represents us as a high-income country at the moment, and you can see how far ahead of lots of other disorders depression falls. And it's true in developing countries as well. Interesting, this postnatal depression that's so often talked about, it may actually be a marker of an even more severe disorder, or it looks like it is a marker of an even more severe disorder, bipolar disorder. And this is really at the less frequent but much more severe end of illness. We see a very particular phenomenon going on around this time of a lot of women who already have bipolar disorder stopping medication, quite reasonably you might think, but 50% of them becoming ill during the course of pregnancy, and of those who survive the pregnancy without becoming ill, 70% of them becoming ill immediately after the birth. So both depression, very common, in my terms as a psychiatrist, slightly less severe, but in public health terms, extremely important, and bipolar disorder, all extremely common at this time. If we look at psychotic illnesses, there's a great increase in relapse in bipolar disorders and another disease, schizophrenia, following the birth of children. And this is the time that we know is the highest ever risk for psychotic illnesses. This is also an important cause of maternal death. If you look at a 12-month period following birth, suicide is always in the top 3 most important causes of death. So that's my concern in a way, traditionally, as a psychiatrist looking after adults, is the mother. And just for the mother's suffering, surely we have enough of an argument to be delivering good health care, and we're not. But there's more than that, isn't there? And that's why you're all sitting here. And increasingly in our research in psychiatry, the voice of the baby has been heard louder and louder. And I think we have to pay tribute to Vivek Glover, who's sitting in the audience today, for much of that research, that groundbreaking research that has shown us the impact of anxiety and depression on the developing child. And as we've already heard, it's not at all surprising that there is an impact on the developing child, particularly the brain of the developing child, that all-important organ, which is what makes us human, is developing, as George said, extremely rapidly at this time. And the brain is an organ that is absolutely sensitive to the external environment. What is the external environment for a fetus? The mother. What is the external environment for a child in the first couple of years of life? Primarily the mother in our society, but certainly the primary caregivers to that child. The mobile hanging over the cot, or the colour of the paint in the bedroom, or the traffic noise outside, are really insignificant irrelevancies. It is the human beings looking after them that are their entire environment, and that they are learning everything from. And what you are now is to a very large extent what you learnt in utero and in that first year of life. And here's just a couple of slides I'm going to show you illustrating some of the findings from some of this research. So this, for example, looked at anxiety towards the end of pregnancy, showing very clearly, and in subsequent years of this research, that this is associated, even if you take into account all other known factors predicting emotional and behavioural disorders in children, anxiety in late pregnancy is associated with a doubling of the risk of these significant, important disorders in children which have strong continuity into adulthood. So you are talking about children with problems who become adults with problems that cost our society a great deal of money, but cost them a great deal of suffering and chaos in their lives. And when they have children, will impact on their children. So we are here to break a cycle. You can see the same thing with depression, particularly depression in pregnancy, but with maternal depression. And this slide, for example, shows a number of things, but I think one of the most extraordinary things that this study in the South London deprived population showed, that if you look at depressed adolescents, all of them had mothers who were depressed in their childhood. So what do we do with all this data? And there's loads more of it. I could spend 5 days talking to you continuously with great excitement, but I've just shown you a tiny little illustration of this data. What do we do with this data in terms of policy and guidance? Well, this is an exceptional area of healthcare. And you heard earlier on about talking and working with your health partners. The policy and guidance to guide those partners is completely in agreement, unanimously and absolutely clear. We have to take action. And this is guidance at every level. Are we doing it? Is the healthcare system doing it? No. And this is not new guidance. This is guidance that's been around for years. If this was coronary care, there would be a scandal, an outrage. It would bring down the government. It's mental health. It's mental health in women. It's mental health that's going to impact on children. And I'm afraid we are no better than in Ireland. We are worse. We don't even have a minister for children dedicated, that I'm aware of yet, but George is working on it. I hope. And we're not doing what we say we ought to be doing. So you have fertile ground in terms of policy and guidance, but you don't have fertile ground in terms of getting people on board. So this is just to illustrate it. This is the sharp end of the pyramid, as we often describe it in mental health. The vast majority of people don't go anywhere near highly specialized mental health services. The vast majority of people with mental health problems get primary care, absolutely right, and things like IAP services, who should be your absolutely first port of call in health systems. So I hope you know who IAP services are, increasing access to psychological therapies. Freely available through the NHS, supposedly to everybody who needs it. Primary care level therapy. Okay, you absolutely need to work with them. They need to prioritize women in pregnancy in the first couple of years. But this map just shows the sharp end, the specialist perinatal services. And where there are colours, there are services of some sort or other. And you can see great swathes of this is just the south of England, but it's the same above that horizontal line. There are great swathes of the country with absolutely no access to any specialist services for women at this time at all. And that would contrast very sharply to a quite simple map for physical healthcare in maternity, which would show the whole country covered. The Mental Health Alliance is fighting unanimously, all 40 of these national organisations working together for three things: awareness, education and action. And these are aims that I would hope to see to some degree reflected in your bids. These are things that we should all aspire to. All women and their partners are expecting a baby or considering starting a family, being aware of the mental health issues and emotional issues involved, as well as the physical health issues. And we're not bad, we're not brilliant, but we're not bad at information and awareness about physical health, but we're appallingly bad at emotional understanding. And they need to know where to seek help for themselves and for others. Education. The people who are working in healthcare and in social care with women at this time don't understand mental health. Now, that is a very broad generalization, but I frequently hear this from people themselves. We don't do mental health, is what I frequently hear. Now, that has got to be completely unacceptable from anybody in any type of care services in any sector. So women should be able to expect to speak to people who have some degree of knowledge about mental health. And finally, action. Women should have access to services, and services at every level. I mentioned therapy services available for self-referral, which is what IAP services should be doing, right the way through to highly specialist perinatal services, which should be available to all women throughout the country, but currently aren't. So work together with health partners, but remember, mental health has an impact throughout the whole of our statutory and non-statutory systems. And dealing with mental health requires partnership, exactly what you are setting out to do. So make it an important focus of what you are doing. It will pay dividends. There is science there to tell us that. And if you can manage to achieve that, then those women who've been buying lottery tickets in the hope of a better future throughout their lives will truly have won the lottery. Thank you.